and I have the pleasure once again of welcoming our CEO for Muskoka Algonquin Healthcare, Natalie Bubela. Thanks very much for taking the time to come in today.
Oh, my pleasure, James.
Really
Always.
appreciate it.
Yeah.
We haven't had you in, I think, since the start of this pandemic, so it is nice to have you see your face across the table again. Natalie, we want to talk a bit about some of the easements of protocols at the hospitals that are happening right now, most currently visitor restrictions for inpatients specifically. Yes. Can you just tell me a bit about that?
Sure. We've developed a policy around essential visitors only at the hospital. As long as our community transmission remains low, as it has been, we believe that we can support some additional visiting in the organization. So what's happening here is that eligible patients are able to designate a care partner that can come into the building between the hours of 10 a.m. and 4 p.m. That individual needs to abide by some of the requirements that we have in our policy. So things like they must be screened and be negative for COVID symptoms when they come into the hospital. Need to wear a visitor's badge when they come in. They can visit between 10 and 4. They are able to go in and out of the hospital once during the day. A number of other things as well, including wearing a hospital-issued mask, need to maintain the physical distancing, just like you and I are doing right now. Continue to do frequent hand washing to minimize any infection risk in the organization. Should there be a requirement to wear additional personal protective equipment, where our expectation would be that they would abide by that. And provide the care and the support that patient requires.
So, Natalie, I just want to go back a bit to when this pandemic started and some of the protocols that were put in place at the hospital. Just overall, wanted to get a feeling from you of how you feel this has gone in terms of controlling the situation. I know that there's been sick patients with COVID-19 in both hospital sites, and obviously there has not been an outbreak at either of the sites, which should speak to the protocols you've had in place. So please tell me about that.
Yeah, so we have a command center in place, and it's continuing to meet, and we have a variety of individuals that are part of the command center. And I'll tell you, the volume of information that people on the command center, including myself, have had to read on a daily basis and interpret, and then place into policy or procedures in the hospital has been huge. So I really do have to commend everyone on the command center, and clearly our physicians and our frontline staff as well. People have been exceptionally vigilant. So as we've interpreted the different directions and the directives, people like Allison Snelling have ensured that communication has gone out to all staff on a regular basis. And we've done frequent leadership rounds. So putting all of that together, I believe the hospital's become a very safe environment, and will continue to be that way in the future, because we're continuing to abide by the physical distancing rules, as well as hand hygiene and other IPAC requirements. So it's been great. We did have to reduce some of the non-essential services at the very beginning of the pandemic in order to be able to free up staff to care for the projected load that we were told we could expect with the pandemic coming forward. So we're slowly resuming some of our services. And I'm really pleased to say that we've done a very measured resumption of services for surgery. And this week, we're back to 100% of our pre-COVID capacity for surgery. We still have a bit of a backlog to get through. I would say anywhere in about a 6-week range, then we will be through the backlog for general surgery.
Okay.
There are still some backlog for endoscopy procedures, and some of our specialty procedures like cataracts, urology, gynecology, traditionally usually have a longer wait time anyways, COVID related or not. And so we are slowly working through those volumes. We've resumed activity as well in our elective diagnostic imaging, so not the urgent and emergent diagnostic exams that were required. We're getting up to about 90% of our pre-COVID activity there as well. So slowly moving those services back up. There are other services that we want to resume very soon, and that would be things like outpatient rehabilitation, our nutrition dietitian consults, as well as diabetes education. And those are in the works for the very, very near future.
Natalie, I just want to identify some of the personal sacrifices that all of your staff have been making. One of the instances that comes to mind when I was speaking to your head doctor a while ago about medical staff actually finding different places to reside
Yeah.
from their families
Yep.
during the pandemic. It's just an amazing, sad but amazing sort of sacrifice that they're making
Yeah.
to make sure that their families are protected, right?
Absolutely, and we were very, very fortunate. Besides a lot of the donations we received around personal protective equipment, we also received a lot of donations, if you want to call it that, of places where people could stay for those individuals that were not comfortable going back to their home environment and potentially spreading COVID-19. So very generous donations of either hotel spaces or other accommodations in the area, and our staff took advantage of that. There's no question there was a lot of fear at the beginning. There's still a lot of fear out there.
Yep.
But I think we understand it a lot better than we did at the beginning of the pandemic, and I'm exceptionally proud of the sacrifices our staff have done.
Well, Natalie, I mean, on behalf of everyone in Muskoka, I just want to say thank you to you and your staff for all the work that you have done during this pandemic. We really appreciate it.
Yeah, no, thank you. It's definitely our staff and our physicians and all our leadership group that have really come together and worked so well.
All right. Well, thanks for taking the time again today to chat with us, and we look forward to having you in studio again, possibly a little closer together maybe next time. But yeah, we do appreciate it, and thanks, Natalie, for coming in.
Thanks, Jay.
All right. We are going to take